wonderful kids, and this is your teacher Nana. I'm here with a wonderful session for the class 5, and everyone, welcome to Swiflearn and welcome to our today's session. And Swiflearn is India's most sincere learning destination for the classes 1 to 10. Here we are providing 100% live and interactive classes, personalized attention batch with maximum 6 students. That is why teacher can pay individual attention to all these kids and there will be an effective learning. So everyone, let's look at our key features that are detailed progress report and Swiflearn academic test series. That is why you can take unlimited practice tests from Swiflearn and subjective tests for school exams. So everyone, if you are new to this channel, please subscribe and press the bell icon. You will never miss any important updates from us. So over here, today we're gonna learn about disease and hygiene part 1. So do you know what is meant by disease and what is the hygiene? So let's have a look. So these are our today's objectives that are: what is health and disease, types of diseases and communicable diseases, disease caused by bacteria, disease caused by the viruses, disease caused by the protozoans, and disease caused by the worms. So these are the things we will learn today within this chapter, and I hope you have the pen and the paper to take notes while I'm teaching. So over here, this boy is so active and he's cycling. So how many of you go for cycling in the morning? Or how many of you go for walking in the morning? Very good if you're doing such physical exercise early in the morning. And why do you go for cycling or playing the sports? Look at this boy, he's playing football. And he's very active, right? So what are the benefits of exercises? So exercises are helping us to stay fit and stay healthy. So the doctor says a healthy mind lives in a healthy body. So what is the health? That is a relevant question, right? So let's have a look. So the health, I can give an example. So Ibrahim is a healthy person, which means he is not having any kind of disruption within his physical, mental or social well-being. Or he is not having any kind of disease or infirmity. So the person is really healthy. So it means health is defined as the state of complete physical and mental well-being and the absence of the disease. So please take note the term disease because we're gonna learn about the disease. So this is the definition of the health. Okay, I hope you understood. And over here, suddenly, Ibrahim got a fever. So what happened to him? Now he is not feeling well, right? So which means he is suffering from fever and it's a type of disease. So if you are not feeling well, which means you are suffering from some kind of diseases like fever, headache or stomachache and so on. So over here, what is the disease? What do you think? Can you define it? Yes. So Ibrahim got fever. So the fever is a type of disease. So disease means any condition in which that interferes the normal body functioning. So after getting the fever, the proper functioning of the Ibrahim's body got interrupted. So the reason behind it is the fever, and the fever is a type of disease. So any condition that interferes with the normal body functioning due to some reasons is called the disease. So can you give some examples for the disease? It can be the toothache, it can be the heart disease, it can be the fever, flu. We have a lot of diseases, right? Yes. So what are the causes of the diseases? So mainly the diseases are arise due to the infections, such as the infections by microorganisms such as the viruses, bacteria, fungi and so many more. An unhealthy diet, consumption of contaminated food and water. So these are the major causes of the diseases. So please take note. And over here, the types of diseases. So we can divide the disease into two main categories, and the first one is the congenital diseases and the second one is the acquired diseases. So do you know what is meant by a congenital diseases? Congenital disease means you may have heard that the baby born with a hole within his heart. So the heart disease is there from the birth, right? So the diseases which are present in the body from the birth is called congenital diseases. Okay, so the heart disease is an example for the congenital diseases because it's there since the birth or from the birth. So the reasons of the congenital diseases are in two categories. The first one is genetic abnormality and the second one is organs not fully developed. So please take note of these two main reasons behind the congenital disease. So the color blindness is a greatest example of the congenital diseases because it's there from the birth. So I had a student in my class. He is very active and he's super intelligent and smart. But he has a problem with understanding or recognizing some certain colors, which means some pigments are not there in his eyes to recognize certain colors. So the color blind is associated with a problem in vision and causes difficulty in identifying certain colors due to lacking pigment in eyes. So the person is suffering from color blindness. He won't be able to understand and recognize these two colors, and the most common one is red and green color deficiency. So I hope it's clear. And over here, so there are few more congenital diseases. I'm going to explain two more, and the first one is hemophilia. So I can explain with a story. So Maria and Begum are close friends. So they were playing. So suddenly what happened? They fell down and they got injured in their hands and the legs, and the blood started to come out and they got scared. So after some time, the wound got clotted, the blood got clotted, and it's okay now. But for the Begum, the blood didn't stop. It was continuously flowing out. So what happens with the Begum? She has hemophilia. So what is the hemophilia? So hemophilia means the blood loses its ability to clot. So as we know, the platelets are responsible for the clotting the blood, right? Yes. So the platelets. So if a person suffers due to the hemophilia, then the blood loses its ability to clot. So it's a inherited blood disorder. So over here another one is thalassemia. So it's an inherited condition in which the body makes hemoglobin and red blood cells lesser. So what will happen to the person? He will always be anemic. So now we're going to learn about the acquired disease. So the acquired disease can be divided into two. The first one is the communicable disease and the second one is a non-communicable disease. So when we divide into two categories, there are two categories, communicable and non-communicable. So do you know what is meant by communicable disease? So let's take an example of COVID-19 virus. So we always mask ourselves and we are maintaining 2 meters of social distancing if we are at outside, and we are sanitizing our hands and face all the time. Why? Because the coronavirus can be transferred from one person to another. So we are actually trying to prevent this virus from all these methods. Through all these methods. So coronavirus is a type of communicable disease. And the diseases that can be passed from one infected person to a healthy person in direct or indirect manner, it is known as the communicable disease. Can you give me one more example for the communicable disease? Alright, so non-communicable disease, which means the diseases cannot pass from one infected person to another healthy person. So for example, the heart disease, it cannot, right? It is not transferable. Or the toothache. So these are not infectious disease. Now, let's expand and learn more about the communicable diseases. So, the communicable diseases are classified on the basis of the organism that cause these diseases. So, over here, the disease caused by the bacteria, the disease caused by the protozoans, and the disease caused by the viruses, and disease caused by the worms. So, these are the organisms which usually spreads the communicable diseases. And over here, let's understand them one by one. So, disease caused by bacteria. Tuberculosis. So, tuberculosis, it's a condition of disease is caused by rod-shaped bacteria which is known as Mycobacterium tuberculosis. And the incubation period is 2 to 10 weeks. And tuberculosis, the mode of transmission is through air, dust, sputum of the infected person, and how we can prevent it. Before that, let's know about the symptoms. So, cough, sputum with the blood, chest pain, body pain, breathlessness are the symptoms related with the tuberculosis. And how we can prevent it? Can be prevented by the vaccination against this bacteria. And this one is cholera. The cholera is the type of disease caused by the bacterium which is known as Vibrio cholerae. And the incubation period is up to 5 days. And mode of transmission is contaminated water, food and drinks. And the symptoms are vomiting, diarrhea and muscle cramps. So how we can prevent it? Prevented by the vaccination and a sanitization of the food. And the typhoid. This disease is caused by Salmonella typhi. And the incubation period is 7 to 21 days. And the mode of transmission is contaminated water, food and drinks. And the symptoms are high in fever, reddish eruption on the chest. How we can prevent the typhoid? By taking proper vaccine and anti-typhoid vaccine and proper sanitization. Leprosy. This disease is caused by Mycobacterium leprae. And the incubation period is several years. And mode of transmission is a prolonged contact with the infected person. And what are the symptoms related with the leprosy? Loss of sensation, deformation of fingers and toes. We won't be able to feel anything by the sensation. So, should be kept in the isolation is the only method of prevention for the leprosy. So, tetanus. The disease is caused by Clostridium tetani. Incubation period is 4 to 20 days. And mode of transmission is enters directly into wounds from the air. Symptoms: paralysis of thoracic muscle, contraction of muscles. Prevention by the use of antitoxin after body is wounded. And disease caused by the viruses. So, viruses are microorganisms which multiply very rapidly when they come in contact with the living cells. And over here, so this is a body. This is a body of a person. Okay, here is a body of a person. And the virus is entered. So it will be tiny over here, and suddenly when it enters, it's multiply within the second and it fully interrupt the functions of the body because they will be very higher in number. And over here, common cold. So the common cold, the incubation period is 1 to 3 days. And mode of transmission is the most droplets. And the symptoms related with the common cold are running nose, headache and fatigue. So prevention: cover the mouth and nose during sneezing. So let's cover your mouth when you sneeze. So it can be with the elbows or the tissues. Please cover it. So influenza. So influenza is spread by the discharge from the nose and throat of the infected persons and affects upper respiratory tracts, and the symptoms are fever, cold, chill and body ache and so on. So measles. Look at the boy. He's suffering from measles. And it's very common among the children, and the incubation period is 10 to 12 days, and the transmission is through the direct contact with the infected person. And what are the symptoms related with the measles? That are nasal discharge, redness of eyes, high fever, and sore throat. It is prevented by avoiding direct contact with the infected person. And chickenpox. Incubation period is 14 to 16 days, and transmission is contact with the skin sores and patient clues. Symptoms: fever, headache, small watery sores on the skin. Prevention: vaccination against causative pathogens. So chickenpox is a severe one. It can be spreaded easily, so we have to be careful during summers. Over here, the polio. The incubation period is 7 to 14 days, and transmission through the fecal matter from nose and the throat. So symptoms: paralysis of the limbs and voluntary muscles. Prevention by giving polio drops against the polio virus. We usually take the polio vaccine early childhood, so we can prevent the polio virus. Hepatitis. The hepatitis can be divided into several categories or several classifications. Hepatitis A, hepatitis B, hepatitis C, hepatitis D, hepatitis E. And over here, transmission is contaminated food and water. Symptoms of the hepatitis is related with high fever, headache, loss of appetite, and vomiting. And how we can prevent it? By taking vaccination and avoiding infected food. So we have to be very careful when it comes to the food intake. AIDS. AIDS are caused by HIV, human immunodeficiency virus. And it's a severe condition because there are no proper vaccine or the medicine for the AIDS. So incubation period is 15 months and 5 years. The transmission can be through the sexual contact or through the body fluids such as the saliva and the blood. For example, the AIDS having person used one needle. So what happens when the needle is used by a healthy person? So there will be chances of having or transferring the AIDS to the healthy person from the infected person, because there can be chances of having blood droplets within the needle, right? Yes, so we have to sanitize everything. So symptoms: weakens the body and immunity. No vaccine and medicine yet developed, so we have to be very careful with the AIDS. So this is caused by protozoans. Protozoans are single-celled organisms. So amoebiasis, and this disease is caused by Endomoeba histolytica, and transmission is through contaminated water, food and water. Symptoms: diarrhea, gripping pain, blood in stools. So how we can prevent it? Proper sanitization, protection of food from the flies. So always take care to cover your food when you are not using it. So over here, malaria. Malaria, this disease is caused by Plasmodium, and transmission is through the Anopheles mosquito. And symptoms are chillness, severe headache, profuse sweating. And prevention is elimination of mosquitoes by spraying insecticides, especially during winter and during monsoon time. Disease is caused by the worms. Worms are simple animals with elongated bodies, mouth, gut and anus. Elephantiasis. It is caused by a tiny worm called Wucheria bractopti. So transmission is through the bite of Colax mosquito, and the symptoms are swelling of lymph nodes in lymph, scrotum in males and breast in females. Prevented by using bug sprays for protection from the mosquito. Ascariasis. This is the disease caused by Ascaris lumbricoides. Transmission is through unsafe food and water. Symptoms are heavy infestation in lungs. Prevention is good hygiene. So please have a good hygiene and you won't get all these diseases. Taniasis is the disease caused by tapeworm. The transmission is through contaminated food and water, and the symptoms are pain, weight loss, and digestive problems. And how we can prevent it? Maintaining a good hygiene. So these are the questions. Please answer it while reviewing this lecture and name the disease caused by Plasmodium. And what are the symptoms of cholera? Describe the causes and the symptoms and the prevention of malaria. So we learned today about the health and disease, types of disease, communicable disease, disease caused by the bacteria, disease caused by the viruses, disease caused by the protozoans, disease caused by the worms. So thank you everyone for coming today. So please have a proper hygiene and please prevent all these diseases, and you can do it. So if you like the session, please like, comment and share and support us. Thank you everyone.